your topic again gets very much important because we will be listening to all the recent advances, a very broad aspect,
Right.
and you will have advantage of free time. So there is no one after that. So we want to listen the recent advances because psychiatry itself is a very big subject and very complicated. आप किसी को भी पागल बना सकते हो कि साइकियाट्रिस्ट ने मोहर लगा दी अब तो तू पागल ही है.
नहीं सर,
Thank you.
हम ठीक करते हैं पागलों को, हम बना नहीं सकते. So good evening all, and I welcome you all over here and pay my gratitude to Dr. Vitull Gupta, who always gave me a chance to be a part of this MAPICON Academic Fest on day 2. So myself, Dr. Poonam, you all know that I am a professor and head in Malana University. So here the topic is the recent advances in psychiatry, on which I will be discussing. So I had divided my whole presentation into 8 parts, where I will be taking up the digital interventions in psychiatry, number 1. Then the neurostimulation therapies, which are available right now. I will be discussing little bit about them. Then the artificial intelligence, how it is helpful in psychiatry. Further, the detoxification of opioid and other substance uses. Then the involvement of the genetics and biomarkers along with the radiological interventions. Further, moving to the newer drugs which are available with the non-pharmacological CBT therapy and psychedelic assisted therapies. So, as we all know, pagal ke word is very commonly being used by everyone wherever we go, and always the people laugh on us and smile, and it's like this only. Everybody is like lot of huge stigma and neglected part is available, attached with the psychiatrist and the mental health. It's not only the general population, we all are doctors, still we are talking in like that only. So new advances are very much important, though the conventional and traditional methods are also important in the management part. Further, if I go on the census prevalence, the National Mental Health Survey in 2015 and 16 reported that nearly 150 million people, they are suffering from mental health, but only 30 million, they are seeking the mental treatment. In 2016, the National Mental Health Survey reports that 5.1% Indian population, they commonly suffer from a common mental disorders. They are like anxiety and depression. In 2023, NCBI article reports that the prevalence is increasing day by day from 9.5 to 37 people per 1,000 population. So it's the number is increasing day by day. Current challenges in psychiatry is there is a shortage of mental health professionals per population who is suffering from the mental health issues. Overburdened health care infrastructure is there. In the rural area, there is a less of the psychiatrists, psychologists available, and even they don't have a knowledge of this thing that they are suffering from any kind of psychiatric issues. So a lot of stigma is attached. Need is the integration of the primary health care services along with this, so that we can provide the mental health troubles, issues should be addressed properly, diagnosed properly, and then treated and managed properly. So need is for the systemic and the newer technology. Now, my first part on the digital mental health, there is, after the COVID era, that we all in pan-India, pan-world, everywhere suffered this issue. Mental health apps became an online platform, became a way to consult the patient. The doctors use these, in which I will be discussing 2 main, Telemanas and eSanjeevani. In this, the digital mental health transformation has been seen from digital mental health apps to the use of artificial intelligence and the robotic and sensor mechanisms which are being used. Here the speech analysis, facial expression analysis, from there we go on. In this graph it is seen that the chatbots are used. Even we are using the various robotic and sensory methods where the facial expressions, they are being picked up, and we can have a digital details of all the history. Psychiatry history, it's usually 25 years, 30 years, or 40 years. The patient is suffering from so many disorders. We can have a systematic analysis of all the disturbances, and prognosis can be easily made out of it. The various technologies now, I had already discussed in my last slide about this digital intervention, combining the traditional and current methods, the chatbots and the VR and AR technologies, which are very much helpful in the anxiety disorder as in desensitizing the various issues. Now again, supposedly I talk about American Well. There have been a lot of chatbots and the digital ways, apps available for diagnosing the mental health, preventing and also managing this. Now talking about the telepsychiatry, it is a kind of a video conferencing which have been well established in US, Australia, Canada and Europe. This is a kind of a conferencing which is easily done through with a consultant and a patient, especially in remote and underserved areas. But again, we can talk about we are dependent upon internet facilities for using this facility again. So, and even the person who is using the video conferencing or using the telepsychiatry must be master in using the digital interventions and interface. It's not that easy. A person can be easily the benefits. Benefits is a broad spectrum. A certified psychiatrist anywhere can be available. You are not supposed to take a work off from your place and need to go. It can easily fit into your normal schedule. And even the young patients, they are more comfortable using this telepsychiatry app. So Telemanis is a very important app, which is a national tele-mental health program, which is being launched in India with a toll-free number. And the last digits are 14416, very important, through which it's like an automated call generated through IVRS, and it connects to the counselor. As we do the triage in the emergency, similarly, the patient who is reporting the severity of mental illness or the issues according to which the counselor will divide it, will make the patient to know that he or she needs a mental health specialist. Then further, the patient will be registered on eSanjeevani app, and further through the PHC, CHC or other institute, the patient can take the help of a psychiatrist. eSanjeevani, it's the way how we have to cover the universal health coverage is needed, and it's a quick and easy access through the smartphone. We do a registration through a smartphone. There is a login, SMS is given. As we get an OTP, we register, we do a waiting room is as per the availability of the consultant, and then the consultation is done. My second part of this presentation is the neurostimulation therapies. In this, it's a kind of a stimulation we provide to the various brain organs, invasive and non-invasive, to get rid of various mental health issues, in which there is a repetitive transmagnetic stimulation, deep brain stimulation, vagus nerve stimulation, modified ECT and video EEG. So my first is a biofeedback mechanism. It's a kind of it's a technique how it controls the various physiological processes in which we measure the heart rate, muscle tension, skin temperature, and the brainwave activity. Now this is a way how this is performed. There is a patient in front of a visual screening where there is an audio and visual signaling is given to the patient, and a loop is formed between a patient and a screen which is provided in front of it. And the various measurement of the heart rate, skin temperature, and the brainwave is done, and the patient gets information about his or her physiological symptom and asked to do some kind of relaxation exercises, so that a loop is formed and a biofeedback technique is used. It's basically approved for all these things: stress and anxiety, mood disorder, attention deficit disorder, pain management, migraine, headache, sleep disorder, and PTSD. Second is deep brain stimulation. This is an invasive procedure, and there is an implantation of a device or electrode, and there is a pulse generator which is under the subcutaneous in the chest. So this is being, the different organs of the different parts of the brain are being targeted according to the disorder. So deep brain stimulation is used in various kind of addictions: anorexia nervosa, cluster headache, Alzheimer's, Tourette disorder, Parkinsonism, obesity, chronic pain, dystonia, obsessive compulsive disorder. So for example, it has been approved for the first three: Parkinson's disease, essential tremors, and dystonia. The target organ is subthalamic nuclei, thalamus, and globus pallidus. Now, where it is available? It is available in AIIMS Delhi, NIMHANS Bangalore, and NIMS in Hyderabad. So the cost factor, it ranges from 10 to 15 lakh in total. Modified ECT, the important part is already the ECT is being again used with the name of a psychiatrist. एक word पागल और एक बिजली लगाना, दो words most commonly used होते हैं. So modified ECT is a way when there is a use of a sedation or anesthesia along with the giving the electrical currents to the brain and which will generate a epileptic episode. I think everyone is more, there is a two types, direct and modified. Direct is without anesthesia and modified is with anesthesia. So then comes the video EEG. It's the recording of the brain waves, what is happening when the patient is having a seizure in 24 hours. So the various brain activities is recorded through the EEG wave, alpha, beta, gamma, delta, and theta. They have the different frequencies and they have the different properties from where we can come to know what is the patient is having. The purpose of video EEG is to find out the type of the seizure, the exact brain area which is involved in the epilepsy. Third is the repetitive transcranial magnetic stimulation. This technique is, the coil is in the form of 8, is placed near the brain. So it will generate a magnetic field. This will generate an evoked induced electrical current. This will generate an evoked potential, further stimulating the nerve impulse and the target organs. Now this condition, this was first in 1800, it was realized that the nerve cells, they carry electrical activity. Gradually in 1985, it was first time the RTMS idea concept came into light. In 2003, the Canada approved the RTMS for the depression. 2008, US FDA approved it for the depression, and further in 2020 also, it is not only for the depression, it is also approved for the OCD. Clinically approved for depression and obsessive compulsive disorder and few addiction in smoking. But the proof is there is a widespread used only for depression and OCD and addiction, but for others, still it needs the approval and the under trial is going on for various other psychiatric disorders. It's available in all these centers. PGI Chandigarh also, AIIMS Delhi, NIMHANS Bangalore, because many of the times the patient asks from us where these procedures are being done and what will be the cost. I think this is also very much important. Everybody must know where these procedures, invasive procedures, are being carried on. Then comes the vagus nerve stimulation. Again, it's a parasympathetic system. Vagus nerve is known for the rest and digest. As adrenaline system is for the flight and fight, this is parasympathetic is rest and digest. So it will be more helpful in the patients who are suffering from anxiety and depression. As well as this have been approved treatment for the treatment-resistant depression and epilepsy. The treatment-resistant depression itself means that the patient, let me tell you first how this device is being implanted, and it is implanted in the left vagus nerve, not the right vagus nerve, because it innervates the SA node, right one, and it leads to the cardiac arrhythmia. So left vagal nerve is targeted, and the coil is being encircled around the left vagus nerve, and there is a pulse generator. Now the important part for me as a psychiatrist is the brain activity. As it is a parasympathetic, it helps in the resting and decreasing the muscle tension and anxiety symptoms, so more useful in depression and anxiety part. So I had already told it is useful in epilepsy and treatment-resistant depression. Resistant means already you have given a trial of 2 to 3 different classes of antidepressant for an adequate time period with the adequate dose. But if a patient is not showing improvement, then the patient can be taken as an indication for the vagus nerve stimulation. Again, available in AIIMS Delhi, NIMHANS Bangalore, and the cost ranges from 2.5 to 5 lakh per this procedure. Artificial intelligence, again, very much useful. In my third slide, I had reported that it helps in the mental health, recognizing, diagnosing the various mental health disorder by speech pattern, facial expressions, and other behavioral clues. So it analyzes the vast amount of data depending upon the new patterns, and the long history can be analyzed easily. From monitoring to treatment, predictions, and diagnosis and deep learning of the brain, the artificial intelligence is very much helpful in the psychiatry. So it gives a better personalized care, shorter waiter period, removes the barrier of the treatment, and boosts the efficacy. Now the third part of my presentation is detoxification. I will be talking about more of the opioid, because in this already the patients, they are put on buprenorphine treatment. And here I will be talking about the three parts: conventional way of, traditional way of treating the opioid withdrawal, rapid detoxification, and ultra rapid detoxification. Ultra rapid detoxification can be done within 1 day. Rapid detoxification, it needs 2 to 5 days. And traditional method, it can go from 3 weeks to 1 month, 4 months, or 5 months. It's a long period. So the difference among all the three is the traditional method with the use of an opioid agonist, it may take months together, years together for a patient to get detoxified. But if I talk about the ultra rapid, in this the opioid antagonist IV, in an IV form, it is given under the anesthesia, general anesthesia, and the withdrawal is created. So what exactly happens? The opioid, when the patient is continuously taking an opioid, it becomes sensitized to that substance. We have to desensitize the brain. So it is done within a day under the anesthesia. It's an ultra rapid way of doing the a single large dose of opioid antagonist is given when the patient is unconscious during the withdrawal state. So it helps in, and with the anesthesia, we can achieve the ultra rapid detoxification. So there is also the risk factors which are being attached with this, because the patient can possibly can have a problem of pulmonary edema, can get into delirium, there can be electrolyte imbalance also, there can be excessive catecholamine release also, and altered cardiopulmonary functioning issues can also be there. This is already I had discussed the traditional way of opioid detoxification and the rapid way of opioid detoxification. Now my fourth part of this presentation is the genetics and the biomarkers. Again, if we go through the precision psychiatry, to give a, if I talk about, if I want to give a tailored treatment plan to any of the person, I must know the genetic formation of a person, genetic makeover of the patient, along with the use of the neuroimaging. So in this genetic and biomarker research will be helping from the diagnosing, monitoring, and also giving to the prognosis and the treatment part. All these are included in the precision psychiatry. The sixth part of my presentation is psychedelic assisted therapy, which is very commonly right now these days being used. Even the ketamine and S-ketamine infusions being used in the patients to induce the attention-free state of a patient. So psilocybin and MDMA, ketamine, S-ketamine in conjugation with the psychotherapy gives a promising results in the post-traumatic stress disorder, depression, and anxiety. So in this, what exactly happens is it increases the neuroplasticity, dendritic and spine formation growth, axonal branching, and synapse formation. It helps in decreasing the anxiety, depression, and PTSD episodes. This is the magic mushroom. So LSD and mescaline, and these are being agonist, having an agonist action at 5-HT2A receptor, which directly releases the serotonin and the norepinephrine content, and which is helpful in treating the anxiety and depressive disorder. So MDMA, it's 3,4-methylene dioxymethamphetamine, again a stimulant which is given. It's known as empathogens, which is helpful in attachment, trust, empathy, and interpersonal connectedness. So psychological responses will be euphoria and increase in energy. Physical dependence will be there. Again, it's a sympathetic, so it will be having a cardiogenic effect also. It will also raise the blood pressure. It will lead to hyperthermia, dehydration. So these are the physical symptoms which are associated. So ketamine and S-ketamine, ketamine is non-selective, non-competitive antagonist of NMDA receptor, which prevents the brain from excessive excitatory glutaminergic neurotoxicity. So, but on the other hand, it also helps in reducing the severe depressive episodes within few hours. So, the way how we give it, intravenous, intranasal, intramuscular, and oral dosage. This is the how the absorption takes place. Intravenous 100% absorption is there, and it only takes 2 to 3 hours to give the best results in the severe refractory depressive patients. Newer clinical drugs, there are a lot of advancement has been seen in the psychopharmacology. Now, previously I discussed the neurostimulation therapies. Now I am talking about the psychopharmacological therapies which are available with more effectiveness and less side effect profile. But there have been a lot of clinical trials have been going on, and few of them have been FDA approved for the treatment of the various disorders. It's a long list. I will be passing on and will be sharing my slides, can go through various the ways how the receptor activity and all those cognitive enhancers are also there. Now the mainstay with the non-pharmacological concluding slides will be the therapy, the behavioral therapy, which is most commonly, traditionally, conventionally also used, was the CBT. It's a cognitive behavior therapy. The core is, it is very much focused treatment for the present day challenges the person is suffering from. Now, last slides are future directions in psychiatry. It's like the psychiatry in the next decade and beyond will be the primarily a consultative specialty, both for the other physicians and allied. No doubt the licensed psychiatry is working a lot, because each and every day we get so many calls from ICU, from the each and every department, almost 10 to 15 calls from the different departments we get because of having delirium part, depression, anxiety, because the prevalence rate is also increasing. So with the use of a neuromodulation and advancement in the psychopharmacological focus, advanced practice providers will be there through the apps. Digital mental health, already I had discussed, will be helpful. AI integration will be more helpful for predicting, modeling to inform the treatment plans. Multidisciplinary teams, it's very important. It's not only the psychiatrists, sometimes neurologists, neurosurgeons, they have to collaborate together to focus and to work on the, sometimes the person is suffering from Parkinsonism, but along with that, the person is also having a depressive symptoms. So in together, because dopamine decrease in the dopamine level can lead to Parkinson symptoms, along with that, it can also lead to the depressive symptoms. So collaborative team is required. Virtual care, the AR and VR, augmented reality and virtual reality is very much important in desensitizing the programs. Integrated services are important, which includes the psychology, neuroimaging, neuromodulation, and surgical interventions. That is the deep brain stimulation. Crisis care, the suicide as it is becoming very highly increasing day by day, and the patients, the people are getting targeted because of this high suicide rate. So crisis care must be for that, new units must be taken in consideration to take care of all these patients. Summary is, there must be an integration of digital tools, which includes the mobile apps, AI-driven chatbots, VR technologies. Genetic profiling, the biomarkers must be taken in consideration so that we can focus and give a personalized care to the patient. FDA approved digital therapeutic apps, as well as the neurostimulation therapies, which I had discussed, must be taken in consideration for various treatment of the various mental health issues. No doubt we all are working on all these things, but we cannot forget that there is still shortage of mental health professionals to provide the proper treatment to the patients. Thank you all for your patience listening. Any questions anybody wants to discuss, or we can have